Hello, this is Tutor and Student, and today I'm going to be discussing phobia, which is part of psychopathology in the AQA specification. Here is the specification, and as you can see, there are 2 points we are going to be going through in this video today. Feel free to pause and read the specification, and then we will continue. So, first of all, what is a phobia? The definition of a phobia is an anxiety disorder which causes an irrational fear of an object or a situation. As you can see with this lady here, she has an irrational fear of spiders, which is also commonly known as arachnophobia. For AQA psychology, there are 3 behavioural characteristics of phobias that you need to know. These are panic, avoidance, and endurance. So let's start with the first behavioural characteristic, which was panic, and explain what we mean by it. Panic is the heightened physiological arousal upon exposure to the phobic stimulus. It is caused by the hypothalamus, which is found in the brain, as this triggers increased levels of activity in the sympathetic branch of the autonomic nervous system. Now, do not stress about these terms, as this links to the topic of biopsychology, but I will give you a brief description of what this little paragraph means so that you can understand. So here is the hypothalamus, which, as I stated before, is located in the brain. The hypothalamus has a vital role in controlling many bodily functions, including the release of hormones. Our nervous system is made up of the brain and the spinal cord and the peripheral nervous system, also known as PNS. The PNS is further subdivided into the autonomic nervous system, also known as ANS, and the somatic nervous system, known as SNS. Then, to make things even more complicated, the ANS is subdivided into the parasympathetic and the sympathetic branches. I said that the hypothalamus triggers increased levels of activity in the sympathetic branch, and so what this means is our heart rate and breathing rate increases, whilst vasoconstriction and pupil dilation occur. But like I said, please do not fret about this too much for now, as this is explained in further detail in the topic biopsychology. Now, moving on to avoidance. The key point about avoidance is that it is negatively reinforced. Avoidance is linked mainly to operant condition, in that this type of behaviour is carried out to avoid the unpleasant consequence of exposure to the phobic stimulus. This severely impacts the patient's ability to continue with their day-to-day lives. The third behavioural characteristic of phobias was endurance. This is when the patient remains exposed to the phobic stimulus for an extended period of time, but also experiences heightened levels of anxiety during this time. So those are the 3 behavioural characteristics of phobias. Now let's talk about the emotional characteristics. The main emotional characteristic is anxiety, and an unawareness that the anxiety experienced towards the phobic stimulus is irrational. That is it for emotional characteristics. Simple, right? And lastly, let's discuss the cognitive characteristics of phobias. Just like behavioural characteristics, there are 3 cognitive characteristics of phobias. These are selective attention to the phobic stimulus. I've shown this here by using a blurred background to show that the only thing the person focuses on is the phobic stimulus, which in this case is a spider. Irrational beliefs, which is the cause of an unreasonable response of anxiety towards a phobic stimulus. Here, this lady is claiming that a spider is going to kill her, which shows an unreasonable response of anxiety if we consider this spider as non-poisonous. And the last characteristic is cognitive distortions, which is where a patient does not perceive a phobic stimulus accurately. Therefore, the image may often appear grossly distorted or irrational. So there you have it. We have completed part 1 of the specification, and we can now move on to the second part. The approach used for explaining phobias is the behavioural approach. This man right here, Mowrer, suggested that phobias are acquired through classical conditioning and then maintained through operant conditioning. This is all well and good having a theory, but where is the evidence? Well, here is when Watson and Rayner come to the rescue. In 1920, Watson and Rayner conducted the famous Little Albert experiment. This clearly demonstrated Mowrer's theory, and here is how. Once upon a time, little Albert, the poor baby used in this experiment, was exposed to a white rat. Upon exposure to the white rat, a loud bang would occur, which produced an unconditioned response of fear in little Albert. Through several repetitions of the white rat, a conditioned stimulus, being continuously paired with the loud bang, an unconditioned stimulus, a conditioned response of fear was made. Little Albert didn't just have a fear of white rats. This fear generalized to any object that was white and fluffy. This shows part 1 of the Mowrer's theory that phobias are acquired through classical conditioning. So what about part 2? Well, little Albert's strong fear of white fluffy things acted as a stimulus for avoidance behaviour. Avoidance behaviour is negatively reinforced, hence maintaining the phobia, which is the second part of Mowrer's theory. So let's evaluate this approach to explaining phobias. The first evaluation would be that Mowrer's theory has good explanatory power. Mowrer's theory can explain the mechanism behind the acquisition and maintenance of phobias, which classical or operant conditioning alone cannot do. This translates to practical benefits in the 2 approaches to treating phobias, which we will be discussing soon. Mowrer emphasises the importance of exposing the patient to the phobic stimulus because this prevents the negative reinforcement of avoidance behaviour. The patient realises that the phobic stimulus is harmless and that their responses are irrational, thus translating into successful therapy. However, there are also some negative evaluations for this explanation of phobias. A psychologist named Buck suggested that there may be an alternative explanation for avoidance behaviour. He believed that safety is a greater motivator for avoidance behaviour compared to simply avoiding the anxiety associated with the phobic stimulus. For example, he uses the idea of social anxiety phobias. Such sufferers can venture out into public but only with a trusted friend, despite still being exposed to hundreds of strangers, which would usually trigger their anxiety. This means that Mowrer's explanation of phobias may be incomplete and only suited for some. And finally, the last evaluation is from another psychologist called Seligman. He suggested that there is an alternative explanation for the acquisition of phobias. He believed that we are more likely to develop phobias towards prepared stimuli. Prepared stimuli are the stimuli which would have posed a threat to our evolutionary ancestors, such as fire or deep water, and so running away from such a stimulus increases the likelihood of survival and reproduction, and so this behaviour has a selective evolutionary advantage. This means that alternative theories can explain why some phobias are much more frequent than other phobias. Now, let's look at the behavioural approach to treating phobias. There are 2 approaches to treating phobias. These are systematic desensitisation and flooding. Systematic desensitisation is a behavioural therapy designed to reduce phobic anxiety through gradual exposure to the phobic stimulus. It relies upon the principle of counter-conditioning, i.e., learning a new response to a phobic stimulus. For example, the therapist would teach the patients a response of relaxation rather than panic. This method works due to reciprocal inhibition, i.e., it's impossible to be both relaxed and anxious at the same time. There are basic steps as to what happens in systematic desensitisation in order to treat the phobia the patient has. The first step is that the patient and therapist draw up an anxiety hierarchy together. The anxiety hierarchy is a list of activities or situations related to the phobia, ordered from least to most nerve-wracking. For example, the first level of someone with a fear of spiders may be to look at a picture of a spider, and then the next level will be to have one in a box next to them. As you can see, the second level is more nerve-wracking than the first. For step 2, the therapist teaches the patient relaxation techniques, for example, meditation. In step 3, the patient works their way up through the hierarchy, only processing to the next level when they have remained calm in the present level. And finally, in step 4, the phobia is cured when the patient can remain calm at the highest anxiety level. Let's evaluate systematic desensitization before we discuss what flooding is. The first evaluation is that there is supporting evidence for systematic desensitization. Gilroy and others followed up 42 patients treated in 3 sessions of systematic desensitization for a spider phobia. Their progress was compared to a control group of 50 patients who learnt only relaxation techniques. The extent of such phobias was measured using a spider questionnaire and through observation. At both 3 and 33 months, the systematic desensitization group showed more reduction in their symptoms than the control group. Therefore, this is evidence supporting the effectiveness of systematic desensitization. The second evaluation is that systematic desensitization is suitable for any patients. Anxiety disorders are often accompanied with learning disabilities, meaning that such patients may not be able to make the full cognitive commitment associated with cognitive therapies. Therefore, systematic desensitization would be a particularly suitable alternative for them. And finally, the last evaluation is that systematic desensitization is more acceptable to patients, as shown by low refusal and attrition rates. This idea also has economical implications because it increases the likelihood that the patient will agree to start and continue with the therapy, as opposed to getting cold feet and wasting the time and effort of the therapist. Flooding. What is flooding? Flooding is a behavioural therapy designed to reduce phobic anxiety in one session through immediate exposure to the phobic stimulus. This occurs in a secure environment from which the patient cannot escape. This means that the patient cannot practice avoidance behaviour as this is not an option. As a result, such behaviour is not reinforced and so the phobia is not maintained. Thus, in the case of a spider phobia, the patient will instantly be exposed to a room full of spiders which can crawl over them. This treatment relies heavily on the principle that it is physically impossible to maintain a state of heightened anxiety for a prolonged period, meaning that eventually the patient will learn that the phobic stimulus is harmless. A positive evaluation for flooding is that it is very cost effective. A psychologist with a name I cannot pronounce, spelt Ougrin, compared flooding to cognitive therapies and found it to be cheaper. This is because the patient's phobia would typically be cured in one session, thus freeing them of their symptoms and allowing them to continue living a normal life. However, there is a negative to flooding. Flooding is less effective for complex phobias. For example, social phobias involved both anxiety and a cognitive aspect, i.e., thinking unpleasant thoughts about a situation. Thus, in such cases, cognitive therapy may be more appropriate because this therapy can target the direct causes of the phobia as opposed to the indirect causes. Therefore, this suggests that alternatives may be more appropriate. And there you have it. You have survived the whole video. Give yourself a pat on the back. Here is the specification, and as you can see, we have discussed everything. Thank you for watching. I would appreciate a thumbs up, and if you would like more videos, then please subscribe.